Every mom and breastfeeding journey is so unique, and remember, breastfeeding takes the two of you. This video is here to help you learn what to expect and feel more prepared about breastfeeding baby after birth. Hi, welcome to Lactation with Amy. I'm Amy and I work as a postnatal midwife and a lactation consultant, supporting mothers with their transition to motherhood. In this video, we're going to talk about expectations about breastfeeding your baby in the first few days after birth. Colostrum is the first type of fluid made by your breast while you're pregnant. It's also called liquid gold because it's packed with antibodies, full of nutrients for your newborn, and perfectly designed for their need in the first few days. A small amount goes a long way, and you may or may not see colostrum come out when you're hand expressing in the first few days after birthing baby. After birth, immediate skin to skin for 2 to 3 hours and following baby cues to initiate the first breastfeed. It's so beneficial for a positive breastfeeding or chest feeding journey. It's very normal for baby to be sleepy in the first 24 hours of life, and we usually recommend feeding baby within 2 to 3 hours after birth and then following baby's cues. A healthy baby with no risk factors can have a once-off 6 to 8 hour gap in the first 24 hours of life. A full-term baby is born with brown fat stored behind their neck for this particular reason, so that they can remain healthy with little amounts of feeding in the first 24 hours of life. Picking up on early feeding cues, changing baby's nappy, and undressing baby during skin to skin are all ways to wake the baby up if they're too sleepy to feed, even after the 6 hours. We recommend trying to do this if baby hasn't fed about 4 hours and seeing if baby's interested in feeding. If they're not and they have no risk factors, don't worry, you can do some hand expressing or continue to cuddle baby until about the 6 to 8 hour mark. If baby is still quite sleeping around then we recommend for you to give some express colostrum to feed baby and then entice them to see if they're interested in breastfeeding. In terms of their output, they only need to do at least 1 wee and 1 poo in the first 24 hours of life. They have tiny cherry-sized tummies in the first 24 hours of life, so they don't really need a whole lot of milk. Now, on the second night of a baby's life, they will often cluster feed and be the quite opposite. Cluster feeding is when a newborn tries to nurse very frequently, about every 20 to 30 minutes to 1 hour, and often for like several hours in a row. It can happen at any time of the day, but usually in the evening and on the second or third night of their life. It's completely normal and expected in the first few days and weeks of life. Frequent feeding and suckling increases oxytocin and prolactin release, and prolactin is a very important milk-making hormone which tells your body to make more milk and boost your milk supply. Research shows that this behavior helps stimulate that milk production and support baby's rapid growth and their brain development. The frequent feeding will help with not only sending a signal to your body to increase more milk, it will also provide comfort for newborns and give them that sense of security and safety. Emotionally, I always think of the first day as a really huge day, not only for mothers, their support people, but also the baby of being born. And in a way, the sleepiness kind of allows parents to rest. But then the second day, they realize that they're no longer connected to mommy. They're out, they're awake, and they need to work for food. So when you think about it this way, the wanting to comfort and have cuddles and suck to soothe is really them just want to be close to you because they're not used to life on the outside world. Cluster feeding not only can occur during the first week of a baby's life, it can also occur whenever they go through growth spurts, about 1 month and 2 to 3 months of their life and more down the track. The constant suckling really puts your body into the demand and supply mechanism for your body to make more milk. Not every baby will cluster feed, but it is a sign of a healthy and normal baby if your baby does. So having that mental preparation for the cluster feeding and taking a nap before nighttime can really help you feel prepared for cluster feeding. No matter how much we talk about it, almost every mother gets to the end of the night questioning their milk supply. And I want you to think about whether your baby has slept during the day after breastfeeds, and if they do sleep well during the day after feeds, just not at night, there is no supply issue. If your baby is settled when you're holding them and soothing them and cries when you put them down in the cot, they just want cuddles. Lastly, what goes in must come out. If babies can produce 2 wees between 24 to 48 hours of age and 1 to 2 dark stools, they are getting enough food. From about day 3, their stomachs start to expand and the need for more fluid increases. We hope for your milk to transition from colostrum to breast milk from about 72 hours after birthing baby. Babies can still breastfeed 8 to 12 times a day with 1 to 2 hours sleep between feeds and other times cluster feed. On day 3, they need to do 3 wees and at least 2 poos. So you want the poos to start transitioning into a green, less sticky consistency. And you may also notice some urate crystals in baby's nappy, which is normal until 72 hours of age. From about day 3 to day 5, you may start to feel your breast getting fuller, heavier, and even engorged. Hopefully, the regular feeding reduces the overall engorgement and discomfort that you feel on your breasts. Around 72 hours after birth, your milk will begin transitioning from colostrum to mature breast milk, and you might notice your breast feeling heavier, fuller, and that's your milk coming in, yay! Babies still breastfeed about 8 to 12 times a day every 24 hours, and they will still feed quite sporadically and not every 3 hours like clockwork. Output is the best guide to make sure your baby's getting enough food. So from day 4, baby needs to do 4 wees a day. Day 5, 5 or more wees a day. Day 6, 6 nice clear wees a day. And you want babies to do 2 to 3 yellow seedy soft stools every day. If you notice urate crystals in a nappy, which is a orange pink stain looking thing that often is mistaken as like blood in a nappy, that's actually quite normal. It's a bit of a concentrated pee that does clear itself from about 72 hours once your milk is coming in. If the urates persist past 3 days, you probably need to chat to your midwife or lactation consultant and review whether your baby is feeding well and review your supply and monitor baby's weight. A key tip during this transition to motherhood is that every day will look so different and there's probably so many things on your mind to do. If you have a supportive team available to you, seek out for their help, get them to cook for you, clean the house for you, do the chores for you, while you and your support person focus on looking after this baby and giving them lots of cuddles. Get other people to take care of you by giving you water when you're breastfeeding, giving you a snack and putting it next to you in case you get hungry. And while babies are cluster feeding, if they've had 2 to 4 hours of breastfeeding and they're finally showing signs that they might settle with some cuddles, then taking shifts with your partners can be quite helpful. So if a baby needs to breastfeed, you breastfeed baby for a couple hours and cuddle baby in between, and then wake up your partner so that they can hold baby and then the mother can have a sleep. Feeding frequently is biologically normal, and babies are humans. They have their particular needs at particular times. The way that they're crying to you is just the only way they can communicate with you to show that they're not comfortable or they need cuddles or that they're hungry. So whenever a baby's crying, pick them up, hold them, cuddle them, see if they settle. If they don't settle, that's fine. We'll put them down, check their nappy, change the nappy if it's dirty, try to soothe baby again and see if that works. If baby is crying and showing those feeding cues, mouth opening, sucking on the thumb, then they're hungry and we'll put them on the breast for a feed. So it's a lot of troubleshooting and reading baby's cues and trying to learn your baby in the first week of their life. And you're not going to be spoiling them by cuddling them too much or feeding them often. It's just their biological need at this time. And remember, this phase is temporary. The days feel long because you're not getting much sleep. You'll learn to sleep when baby sleeps, and babies will eventually sleep better. I've made a particular video about the science behind baby sleep, when sleeping can get easier, and things like that. So click into that video if you are struggling with sleeping with a newborn. Even though breastfeeding is natural, it's not always easy, and you're not alone. So you reach out for help from your local midwives, lactation consultants, child health nurses, your doctors, and seek help from your support people, your village, and tell them what you need so that they can take care of you while you take care of baby. Lastly, while some things are normal in the first few days and they're expected, there are a few signs that it's time to reach out for help. So if your baby has not fed for over 8 hours, especially if they're hard to wake, or if feeding is really painful every single time you're ending up with severe nipple damage that's getting worse every day, That's when you need to look at the positioning and latch of your baby and see a lactation consultant. If your baby is not maintaining their latch on the breast, as in they are going on, off, on, off, on, off, then they're usually not getting a lot of food out. We want baby to latch, stay on, take rest on the breast, but remain latched on. If your baby has inadequate amount of output, wheeze and poos, that's probably a sign baby needs more food. If you have no signs of milk coming in, and when you're expressing you're not seeing anything come out, your baby has reduced output, then that's probably a sign for you to speak to a lactation consultant to check your milk supply. Or if you're experiencing more than baby blues, if you're having trouble coping from the sleep deprivation, if you're not feeling like yourself, please reach out and speak to someone about getting support for yourself. If there's any partners watching this, partners can play a huge role, especially during those long cluster feeding nights. If your partner prefers for you to be there with them, you can keep their company by just sitting with them at 3 a.m. so that they feel less alone. You can try to bring snacks or water while your partner is breastfeeding, because breastfeeding is a thirsty and a hungry work. You can help with nappy changes and burping or settling baby after feeds or between feeds. You can give baby a cuddle so that your partner can have a nap between feeds. You can take baby out for a walk or do a bath with them and use that as a way to bond with your newborn while the mom is working hard breastfeeding baby. You're also probably the main source of emotional encouragement. So words of encouragement like you're doing an amazing job, and there's no oversaying that, because I feel like mothers are really quite emotionally vulnerable, and all the hormones are making you do everything you want to do for your baby and so much more. And there's so much expectations from the society that mothers need to do this. So words of encouragement can go a long way. After the first 3 to 5 days of the baby's life, we need to weigh baby every week and track baby's weight gain to make sure that baby's putting on enough weight and growing optimally for their brain development. You can weigh baby at local child health centers with lactation consultants, and go to your GP for extra support. If you're struggling with nipple pain or breast engorgement, I have made other videos troubleshooting these complications for you. So this video is quite general in nature, but I hope it helps you feel just a little bit more prepared going into hospital to have your first baby, or give you some refresher as to what's normal for the first week of a baby's life. See you in the next one. Bye.